Hello and welcome to YHTV's Magical Medical Tour. This is episode 55. Thank you very much for joining us today. I'm Christina Suzama, and with me is our wonderful medical guide, Dr. Glenn Woolman. Good day to you, Dr. Woolman.
And how are you, Christina?
Absolutely wonderful.
Good. And greetings, everyone. Welcome to Magical Medical Tour. I'm Dr. Glenn Woolman. I will be your medical guide, along with Christina, as we travel through another quadrant of the healthcare galaxy, searching for ways towards optimal health. You know, Christina, when people get hurt, they usually go to a doctor. I'm talking about a physical injury of some kind. They usually go to a doctor, and a doctor makes a diagnosis, tries to determine whether or not they may or may not need a surgery. If there's a potential for them not to need surgery and avoid it, or they do need surgery and they have to heal from it, there are two special groups of people, world-class professionals. There are physical therapists and Pilates instructors. And these are the people that potentially help us to prevent a surgery or to heal well from a surgery and to heal optimally. Today we have a very special guest, Dr. Deidre Manns, who is a specialist in both Pilates and physical therapy. She has her doctorate in physical therapy. But before we speak with her and learn her story, why don't you tell people how they can get in touch with us?
Great. Thank you, Glenn. For those of you who might be watching live online, you can actually scroll down from the screen and there's a little comment box. There you can put in your comment or your question, and I can read it out to our guest and Dr. Woolman. And if you would like to do this personally and ask your question personally, you are very welcome to dial into 323-476-3672. And the PIN number is 607-393-pound. And this number, in case it went by a little too fast, should be coming up on the screen during the live presentation. There you go, Glenn.
Thank you. That's perfect. So today, as I said, we're going to be interviewing and fortunate to have with us as a guest Dr. Deidre Manns. She's a doctor of physical therapy and a certified Pilates rehabilitation specialist. So we have a great story to tell today, and I want to get to it right away. Welcome, Dr. Deidre Manns.
Hello, Glenn. Hello, Christina. How are you?
Hello, Dr. Deidre. How are you?
I'm doing well. Thank you.
Great. Thank you so much for honoring our community.
Oh, it's my pleasure. And thank you so much for having me.
Deidre, as the medical guide, I usually like to tell our audience the direction we may take today. So I want to just start with learning about how you decided to become a healer, when you did that, and how you went about that. Then I want to talk about your profession as a doctor of physical therapy and a Pilates instructor. I want to go through that. And then I want to take you on other parts of the journey that have been part of your life. And we'll see where we can combine all of those and see how we learn from each and the benefits and negatives of each of the things that we're going to be talking about today. Is that all right with you?
Sounds great.
Excellent. So why don't we start with when and how and why and where you decided to become a healer, and take us up to about the year 2003 to 2004.
Whoa, that's a long time. Okay.
It sure is.
Well, being a healer probably came from the influence of my grandmother, who was a nurse. And I just loved how she seemed to be very passionate about what she did. And she was very knowledgeable, and she seemed to be a kind of a pioneer in her field at that time. And so I started to really look into medicine as a career. And I guess back when I was in high school, that's when I made a little bit more of a definitive choice. I didn't want to necessarily be a physician because I was like, I don't want to be in school for, ever. but it seems as though I was still in school forever.
I was going to say, nice.
But and then I also wanted to have a little bit more of an interaction with my patients, versus having, and just that was just coming from my own experience as a patient. When I saw my doctors, even back at 19 dot dot dot, when they had a little bit more time to spend with us. Um, it just seemed to be a little bit brief, and so I didn't. I wanted to find something that was going to be where I can have a little bit more contact with my clients or my patients. And I didn't think nursing was it either, because when I saw nursing, I said, well, I don't think I'm going to want to be doing a whole lot of blood and gore. So I decided that that probably wasn't it. And um, then I was a dancer in high school. I went to Montclair High School in Montclair, New Jersey. Go Blue! And I went to, and I got exposed to athletic training somehow, and the head athletic trainer was also the English teacher at the time, and he asked if I would come and assist him. So I did, and I learned how to tape up sweaty feet and knees. And at that time, that we were working with the varsity football team, who was number one in the state, by the way. And
Go Blue.
go Blue. And so it just kind of went from there. And he said, what you should probably look into is physical therapy. And I did. And it became much more of a arduous journey than I had anticipated, but I made it. And that's how I became a healer. So that takes us to probably 1997, which is when I got an associate's degree in physical therapy. So I was a physical therapist assistant at that time. I had already graduated with a bachelor's degree from SUNY Stony Brook, and I had applied to physical therapy schools in the New York region, New York, New Jersey region. And at that time, it was probably, I remember, the state university, no, I'm sorry, CUNY, which is Hunter School, which is the City University of New York. They had a physical therapy program there, and I remember applying there. And at that time, there was 900 applicants for 30 seats. So I'm sure that it's very, very close to that at this point, as far as the competitiveness to get into physical therapy programs. So anyway, I also applied to physical therapist assistant program. I got in, went to New York University. When I finished that in 1997, I worked for the Hospital for Joint Diseases Orthopedic Institute in Manhattan. And they also have the Harkness Center of Dance Medicine, which is world renowned dance medicine center and clinic. And I worked there with Donald Rose and Mary Jean Liederbach at that time. And these are two big players in the dance medicine world and physical therapy world. And that's when I got exposed to Pilates there for the first time, and continued my education, got into PT school in 2000, I guess, finished in 2001, I'm sorry, finished in 2004. So we're at 2004. Should we end there?
Yes, that's a good idea for just a moment or two.
For just a moment or two.
So there are many people that are considering careers in physical therapy and Pilates. Would you just briefly tell us what it takes to become a physical therapist and also a Pilates instructor?
For a physical therapist, for those people who are interested in knowing more about what physical therapists do and what the requirements, the general requirements are to get into physical therapy schools and to continue on as a physical therapist, you should go to the website www.apta.org. That's for the American Physical Therapy Association, which is our national association for physical therapists, and they represent us legally. And they're also are the best resource for anyone who's interested in this career. But as far as my own personal experience, it takes quite a bit. You have to have a very high grade point average. You have to to go through the sciences, anatomy and physiology, chemistry, physics, kinesiology, biomechanics. You have to go through calculus, all of those hard things that you hard sciences that you have to go through just to apply to get into physical therapy school. Most physical therapy schools are about 30 to 50 seats per year, and you've got hundreds of people who are competing for those 30 to 50 seats per year. One of the reasons why that is because if you look at the national statistics as far as best jobs to have in the country, physical therapy is not often, I would say it's always in the top 10. So we always have work, and we always are looking for, schools are always looking for great people to fill those spots. So it's pretty competitive. That said, that's as far as physical therapy is concerned. As a Pilates instructor, however, you do not have to have a college degree. You can go to any Pilates program that might be available to you around your area. The one that I chose and I believe is the best is Polestar Pilates. There you can go to polestarpilates.com and you can get information on becoming a certified instructor there. I am currently an educator for that program, and it is one of the better programs because it facilitates clinical and not clinical, but critical thinking. And it also has a physical therapy background. The CEO and president, Dr. Brent Anderson, is a physical therapist, and he's had that company going for 20 years. So it's a great program. It's an international program. So if you get certified as a Pilates instructor, you can also if you go through a program, a full comprehensive program, you get a chance to sit for the Pilates Method Alliance certification. And for anyone who is looking for more information on that, you can go to the pilatesmethodalliance.org. So that's kind of it. I hope I answered.
That's good.
Yeah.
Tell us that most of us know what physical therapy is. There might be a few people on the planet that aren't quite sure what Pilates is. Would you give us a definition of Pilates and also tell us how they complement each other and how they differ from each other?
A definition for Pilates. Well, that is a very interesting question. I often get that question. Well, what is Pilates? Well, it's typically what is a Pilates. So and then I have to do a little education. For those of you who don't know, Pilates is Joseph Pilates was a person who developed a program of that is a mind-body, very much in the sense that yoga is a mind-body connection, where he originally believed that you should be able to control your body with your mind and your mind with your body. So he has pretty much come up with 3 tenets, which is whole body commitment, breathing, and whole body health. So that is, and it was a lifestyle for him. And he taught it as a lifestyle, and it continues to be, or it should be considered as part of a lifestyle versus exercise regimen. So what we do in Pilates is that we teach different aspects to help people concentrate better on what they're doing, to make it very specific, make movements very specific and very tailored and very centered to a purpose, actually. So again, when we're talking about Joseph Pilates, we're talking about this mind-body connection, and the way that we teach the mind-body connection is actually centering yourself, concentrating on what you're doing, making the movements very precise, and understanding that you have the control over your body. And that's just my opinion. And I'm sure there's others that can give you their opinion, and I'm sure that they might have be able to, take it to a broader level. But in the very essence of what it is, Joseph Pilates was a German. He's just like, no, it's not going to be, kind of left. It's left. So, so, it's about centering. It's about being very specific. It's about being aware of your, of yourself. And I think that in movement and in life, we aren't necessarily aware of ourselves. And so I think that Pilates in this case can really help to gain awareness and control over yourself.
That means that when you're learning the exercises and the movements and the coordination and the core and connecting body, mind, and breathing in the room where you're doing the Pilates on the apparatus or on the mat, then you take those same lessons and use them in real life. How to sit down, how to stand up, your posture, lifting things. Is that correct?
Absolutely. Well, I'm happy that you brought this up because there's a little bit of in the physical therapy world. Pilates is very complementary in the physical therapy world. However, Pilates is not well known in the physical therapy world. Here in Los Angeles area and Southern California, and even in California in general, Pilates is well utilized within the physical therapy community. However, it is not that case all over the country. So in the grand scheme of things, Pilates was actually had its birth around a little bit later than physical therapy, not much later than physical therapy. And what physical therapists seem not to understand because they don't know is that they think that Pilates is not a functional activity or a functional form of exercise. Mm-hmm. So you're about being able to utilize to have the awareness of the core or whatever. The core is what everyone equates Pilates to, but it's so much bigger than that. It's the entire body. The core is the foundation that you move upon. So the awareness of movement, the awareness and concentration of movement that you gain in Pilates does translate into a functional activity, and that hey, that means that I don't have back pain when I go from sit to stand because I'm supported. I know how I'm supposed to hold my posture. I am utilizing my leg muscles and my flexibility and my strength all as one, so that I can execute a functional activity.
Nice. Basically, you work with a lot of Pilates instructors, and you work with physical therapists, and maybe get together at conferences and maybe socially every once in a while. Just as a consensus, what's the one feeling that therapists and Pilates instructors get from their clients and patients that makes them feel good? What do they like to hear?
Well, it's very interesting because just like physical therapists, Pilates instructors are, very specific about a goal. And oftentimes, as physical therapists, we are trained to look for malalignment. We're trained to look for poor biomechanics and body awareness. We're trained to look for the reasons why the person came in with knee pain. The pain might not be from the knee. The pain is manifesting in the knee, but the cause of it might not be, the source of it might not be the knee. So what we are trained to do is find the source and fix it. And in Pilates, what the movement, when you're trained as a Pilates instructor, you're trained to analyze movement and make sure the movement is very specific and make sure that the person is executing the exercise as well as you intend it to be. That said, what the commonality seems to be is that, there seems to be this thought by some clients that they feel like they have to perform for us, physical therapists or as a Pilates instructor, and they seem to be really hard on themselves because they're not doing it right. But what happens is, in fact, I had a client recently that I was talking to, and I said, it's okay for you to, not get it 100% of the time. It's okay. And so, um, what I like to, bottom line is that we're trained to, really nitpick at things. However, we want people to come out with a positive experience from being with us. So we want them to be able to walk out the door without pain. We want them to to go on and function the way that they ultimately want to function, and ultimately achieve whatever goals that they can. So that's, the bottom line. Even though it seems tough, like tough love, it's really about letting that person explore and be who they are.
Yes, I've had many issues with physical therapists that have saved my life, and it is tough love sometimes, but they're great at it.
Yeah.
And I and many other people are appreciative of that.
Good.
When we talk about physical therapy and Pilates, usually we talk about after somebody gets injured or after surgery for healing. But what has Pilates and what has physical therapy done in the world of prevention and preparation?
That's a great question. Well, as a physical therapist, we are trained to be preventionists. Pretty much, we are trained to teach people how to. Um, or, we'll use ergonomics for an example. We are trained to set up a workstation. We're trained to look at how someone is sitting in order to make sure that they are not going to come into our office. Okay. And to
Hmm.
give a skill set so that they themselves can treat themselves. And that's one of the things that I think is important about physical therapy. um, you might have to go to physical therapy for a long period of an extended bout. However, we're not in the business to keep you on our roster. We're here if you need us, but we're here to give you the tools that you need to for you to be your own interventionalist. Okay. And that is really important. And so, again, when we come from a physical therapy perspective, we can teach, and we do teach prevention. We do teach wellness. Um, Unfortunately, in the scheme of the current healthcare model and insurance payment, it's difficult to have that be justified in for payment. However, we are the group of specialists that should be and are starting to really implement prevention and wellness in our programs. From a Pilates perspective, it's all about wellness as well, and prevention. There are often times that Pilates people come to Pilates because they've been hurt, or they've just left physical therapy and they want to have another program that they're going to be some sort of strengthening program that they can have to assist them with getting back to a full function. And they often go to a Pilates studio to do that. And in that way, when the person gets stronger and they learn about their body awareness and they learn about the concentration and how to utilize their muscles and joints and nervous system and brain, then they can ultimately hope to prevent injury as well. So we work very closely together, um, and it's a great marriage in my opinion, and which is why I've sought it.
I agree with that. So, Deidre Manns is graduating, doing physical therapy, doing Pilates, having a great life, and 2005 comes along.
2005 comes along. Yes. 2005, I was diagnosed with breast cancer in 2005, a stage one breast cancer. And that threw me for a loop. But I have had fibrocystic breast disease since I was 19. So, what is that? That means that I have very dense, bumpy breasts. So I had kind of been under surveillance because I had one of my female family members had already been diagnosed. and she went through her journey. And so I had been under surveillance from that time, and then I went back for one of my regular. Well, I say I was doing my own self exams for since I was 19, and then I actually found the lump. We had it looked at. She said, "Let's go in." She did a biopsy, and we weren't expecting it to be positive, but it came back positive. And so I was like, okay. And so the journey started at that point.
What was your first feeling when you heard that across from the doctor's desk?
Um, what was my first feeling? I guess shock and awe.
Mm-hmm.
Shock and awe is the only way I can describe it.
Deidre, you found you had the lump and they worked you up, and then the doctor went in and did surgery, had to do a second surgery. And tell us what happened during the second surgery and move forward from there.
Okay, so the reason why she went in to have a second surgery was because she wanted to get a larger amount of tissue that was surrounding the tumor to make sure that there was not any other cancerous cells around it. And during that particular surgery, we decided that we were going to have a sentinel node biopsy, which is a biopsy of the lymph nodes that are in my axillary area, or not all of them, but a few of the ones that are closest to the breast tissue. And they took a few of those out, and they did a pathology test while I was on the table, and they came back negative. And at that point, we decided that everything was okay, and we consulted with the oncologist at the time, and at that time, it looked like I was going to have a 96% chance of a success rate with just radiation and tamoxifen for 5 years after.
So radiation and chemotherapy?
No chemotherapy. I did not have chemotherapy the first time.
Okay.
Okay. So just radiation, which is a 30-day process. And then after that, I went for 5 days, a week for 6 weeks. And then after that, I started a hormone called tamoxifen, or I guess it's actually a hormonal therapy called tamoxifen, and I took that for 5 years.
Mm-hmm.
And then that takes 2000. That was 2011. 2011.
And through that process, did you ever stop thinking about cancer? Was it when they said 96%, was there that 4% that always was in your mind, or did you feel pretty comfortable that it was over?
No, there's always that. Well, for me, I can't say there always is, but for me, there was that, that 4%, chance, or that it could come back. I don't necessarily remember it being, oh, it's that 4%, but it was like, okay, well, it could be there. So, yeah.
So this was a pretty big experience for you. And did it change you in any way? Did it get you to stop thinking about practicing healing, or did it inspire you in different ways? What did you learn from this experience?
For me, that experience actually was the cause of me to do a lot of the things that I currently. It probably helped to propel me to the West Coast, because I had lived in the East Coast for all my life, either Washington D.C. or New Jersey, and I just decided that it was important for me to live life in a different way and explore the world and explore life in a different area. So and as far as healer is concerned, did it change the way I felt as a healer? I don't necessarily know that changed me as a healer. I mean, I'd like to say that it made me more zen or something like that, but that's not the case. And I was I'm kind of I'm a type A personality that's, pretending not to be. But
That's pretty zen.
but it is what it is. And so I just kept moving and kept wanting to excel my career, and kept wanting to go through all the classes and get all the certifications, and get the letters behind my name, as some would say. And um I was very successful at that. So yeah, I just kept going forward. It propelled me. I can't say it propelled me forward, but I can say that it definitely helped.
You went from your master's degree to a doctoral degree, didn't you?
I did. I did. It it eh, it was just one of those things. Yeah, I guess. Yes, I got a master's of science in physical therapy from Marymount University in Arlington, Virginia, and then that was a 3-year program, though. And then I went back a few years later and got a doctor of physical therapy, a DPT, from the same university, and um, so it was part of the challenge. That was part of the challenge for sure. I had gotten a certification in orthopedic manual therapy. I had gotten my Pilates certification by that time. I had my doctorate. I probably had taken, 20 continuing education courses or more within a 4 or 5 year time frame. So um, I was pretty focused
Yeah.
on stuff.
Are are all physical therapists are not DPTs at this point? Is that going to be changing?
Yes, that is. The American Physical Therapy Association. I'm not sure exactly when this came out. I want to say in the early 2000s, probably I think it was in 2000. They came out with a vision, and they called it Vision 2020, that by the year 2020, all physical therapists will graduate with a doctor of physical therapy. Marymount University got their changed their program to a doctoral program in, of course, 2005 after I
Hmm.
graduated. Actually, no. What happened was is that I was on track for the doctoral program, but they just couldn't get the certification in time for my graduation. So it didn't take me many credits to continue on with the doctorate.
So 7 years later, you get diagnosed in 2005, you're back to work, you have your doctoral degree, you're doing all sorts of great things for the community and for Pilates and for physical therapy. You get your checkups, and in 2012, you go back for a checkup, and what happened?
There's a cancer in my lymph nodes. So I
That
have
was
a
in your axillary region or your armpit.
It's in my axillary region. Yeah. So one of the it was and that was like, really? Seriously? Oh, that was oh. And that was in when did that happen? July, I guess. July of 2012. Yeah. Yeah, that happened. And it was surreal. It was a surreal experience, and it was um, um, devastating in some ways to manage. And I uh, dug my head in the sand for a couple of months, actually. I was like, this is not happening to me. And then I, decided to pull my head out of the sand. I was like, okay, Deidre, you got to do something about this. So I did, and I currently am Kaiser Permanente. I work for Kaiser Permanente, and I also do some other things. But in that I am working for Kaiser Permanente. I am a member as well, and when I went to have the mammogram, they mammogram and ultrasound, and that's when they made the suspicion. And I said, I just, my head just couldn't wrap itself around that. And once I went back, I went through a very expedient plethora of tests.
Mhm.
I think I had about 4 or 5 tests done in a week. That was that was also a surreal experience, but I'm very grateful. So yeah, the exams that I had were breast MRI and I had a CAT scan of my entire body under contrast. I had a bone scan of my entire body under contrast. I also had ultrasounds. I had a breast biopsy. Oh no, did I have the biopsy? Yeah, I had a biopsy. All of this happened all like within a week. And gratefully, all but the biopsy came back negative, which indicated that there was not a spread of cancer outside of the region that of my lymph nodes in my armpit. So that meant that I wasn't going to die of that today. So that was good. But there was a week to 10 days that was, I saw the world differently in a way.
Explain that, please.
I don't know. I kind of, there's parts of me that would love to be able to access that again, because when you're in a kind of you're in this nebulous zone where you're not sure what's up or what's down, you kind of, or if you're in a life or death situation, you could be dying. You see the world, you appreciate the world, you see the world in a very different way that I can't articulate, unfortunately, except for you see all the beauty in the world. You see all beauty in the world.
I think that's the Zen part.
Yeah, that's and that's like you really appreciate the world in a very different way.
So now you knew you had to go through more things again. You had to have a surgery, and there was the possibility of chemotherapy this time. How did you prepare for this? What was your support group?
Well, okay, so the possibility of chemotherapy wasn't really a possibility.
Right. I'm trying to be nice.
Thank you. I appreciate you. Well, it was my choice. It's ultimately my choice. And that's one of the things that I'd like your listeners to understand, that ultimately it is your choice. I chose, my doctors said, okay, well, you have to have chemotherapy and you have to have an axillary node dissection. And at that time, they were saying, well, you could have either one. One can happen before the other. And I consulted with a couple of doctors, one outside of the Kaiser Permanente system and a few inside of the Kaiser Permanente system, and to get a few opinions to kind of see where I should go. And the ultimate consensus was that we would do the axillary node dissection, which means that they took all of my axillary nodes that I had available on my right side out. And Dr. Jan Tagasugi, who is the woman, did that for me. And and I had a really good outcome. And after about 6 weeks after that, I started chemotherapy, and I am now on my I just finished my third episode about a week ago. So
you're still in chemotherapy right now as we speak.
As we speak.
As we speak. And that is something that most people hear about, the dangers of chemotherapy, the side effects of chemotherapy. People fear chemotherapy. You're going through it now. Can you share some things with us that will help people as they have to make these kind of decisions, what it's like to be going through chemotherapy on a day-to-day basis?
Okay, sure. Well, gratefully, my chemotherapy regimen is not super aggressive. I am on 2 chemotherapy medications. My oncologist is Dr. Teresa Dubernay, of West Los Angeles Kaiser Permanente. And we decided that, I would be on 2 chemotherapy drugs, which is Cytoxan and Taxotere. They're, depending on, the severity of your cancer, depends on what regimen they're going to utilize. So, I'm afraid I have to be on two. However, chemotherapy, when the prospect of chemo, when everyone told me that I had to go through chemotherapy, I was like, really? I so don't want to do this. I went to, it was just one of those things that I was like, I don't want to lose my hair. I don't want to go through the whole process. It's just going to be so draining, and all the things that you hear, and all the scary stuff that you hear about chemotherapy, um, is true in some ways, but it's not. It doesn't happen. All of those things don't happen to you. But to kind of get back to your question about, how does it make me feel? How does the prospect of chemotherapy feel? It's like, well, okay, well, I could not do the chemotherapy, and there are certainly other alternative medicines and alternative easternized ways that have said that they can treat cancers without chemotherapy. However, my Western mind was not able to wrap its head around that. So I said, okay, chemotherapy it is. And it is, it's been a journey in the sense that you don't quite know what's happening to your body at first, and then your body kind of figures it out. So my third time around seems to be the most successful of the ones that I've had. In a lot of ways, I going through chemotherapy, you have to have a support system of some sort if you possibly can. I encourage that. The first time I went through cancer, I kind of cocooned myself, and I, said I could heal myself, and I was able, and I was, strong, and I can do all this stuff. And this time around, and I didn't actually allow people to help me in a way that they wanted to, and I wasn't sure that I knew how to how to tell them to help me. But a support system, whether they're friends, whether they're family, whether it's a combination of the two, is vital for chemotherapy. And so I don't know, do you want to hear about symptoms? Do you want to hear about, what is it? Do you want to hear anything more about what I'm currently going through?
I think that would be a great idea.
Okay. Well, the symptoms that are associated with my chemo. Now, I should also say that everyone responds to chemotherapy differently. Your doctor is going to say this to you potentially, those of you who are out there who may be dealing with this. They're going to tell you this, and you're going to read the long list of symptoms and potential side effects of chemotherapy. You are going to respond as an individual. You might not have any of those side effects, or you might have some of those side effects, or you might have all of them. The point is that you just kind of need to honor the process, because chemotherapy is no joke. I have to, I'm, like I said, I'm a type A personality. I'm a go-getter, superwoman, pretending not to be one. But what chemotherapy has taught me is to honor the process, to honor the chemotherapy in a way that it's like, you know what? No, you're not going to be able to get out of bed today. You need to honor that. My sister is with me for this episode. By the way, I'm calling I'm journaling my process through chemotherapy, and I'm calling it the Chemo Chronicles. So I'm on episode 3, and my sister has been out here with me for this episode because it seems as though that first week of chemotherapy, the first week after chemotherapy, is the most challenging. My chemotherapy is scheduled every 3 weeks for 6 bouts, for 6 episodes. So my mother was here for the first and the second episodes, and during that time we kind of figured out how my body is handling the chemotherapy along with my oncologist. And we noticed that the first week is really the hardest time, and even if we needed to truncate that down, it's really the first 4 days, 4 to 5 days after the chemotherapy is the hardest time. And so and during this bout or this episode, the fatigue was so profound that my sister pretty much had to get me dressed one day, so I could go out and go to my doctor's appointment and then come home and go back to sleep. I think I slept more than 15 hours or something like that. But that was 2 or 3 days ago, and here I am talking to you. So feeling much more energetic, feeling, like, it's a beautiful day here in Southern California. And, after I get off of, after we finish this talk, I'm going to, take a little bit of a rest, and then I'm going to go and do something else for the day. So it's good. Oh, yes, my sister's reminding me that what I'm doing for the rest of the day, or one of the things that I'm doing, is that I'm getting a white blood cell enhancer, which comes in injection. So that is to help to make sure that my immune system stays high enough so that I don't get sick. Because one of the things that happens in chemotherapy is that your immune system through your white blood cells really gets hammered, and your white blood cell count goes down pretty low potentially. And what we found is mine crashes when I have chemotherapy. So I have to get a couple of these white blood cell enhancers to help to boost my immune system, so I can be a part of the community, and I can do things that I enjoy, and I can have 2.5 weeks of the month to be feeling some version of normal. So that's important. Anything else?
Yes, Deidre, it's my turn now. Deidre, since your first bout of cancer in 2005, and you were on the hormonal therapy basically for the 5 years, it's almost like once you stop the hormonal therapy,
that's a great question. I'm so glad you brought that up. It's science is this funny thing, okay?
It's alchemy. It's amazing.
Funny thing. I stopped my tamoxifen. The regimen, the standard of care for tamoxifen at that time was 5 years to be on the tamoxifen. And I got off in 2011. In December of 2012, the breast cancer panel, I don't know exactly what it's called, but they have this breast cancer symposium and panel that meets once a year or so, and they come out with a new study about tamoxifen, saying that the regimen should now be 10 years versus 5. And it's just the way that science is. Mm-hmm. So now the protocol is 10 years for tamoxifen. And apparently, I don't know if my cancer would have, I would never know that the answer to that question for my cancer, because I'm down a different path because of the timing of everything. But that said, cancer research has made leaps and bounds in the last 10 years, I think more than it has in its existence in the last 10 years. So as far as research and protocol changes and standards of care, it's really made huge leaps and bounds. However, there's still this huge unknown about cancer and breast cancer specifically. I can only speak from that perspective. There's this huge unknown that they're still working towards, and they're still striving towards. But it's it's amazing as a medical professional to be working with a group of medical professionals that in general, it's not the group of medical professionals, but oncology in general, as far as breast cancer is concerned, they still don't know a lot. There's still a lot that they don't know. And I think actually I just was listening to NPR recently, and they just found 4 more genetic markers for breast cancer in this last month that would indicate a woman's breast cancer is due to a genetic cause. So things are moving forward. It's just, it's my path. I'm on a different path.
Mm-hmm, mm-hmm. And during this time, did you change your, I know you didn't, you were very clear about not going into the other forms of medicine or philosophies. How about just your simply changing your diet? Yet, I have had quite a few friends that have dealt with breast cancer, and as you say, I've seen them go through chemo and all these different levels, as you mentioned, from not, really being totally affected to not being able to even step out of bed or roll out of bed the next morning. Um, for yourself, did you change your diet or nutritional?
Yes, thank you so much. I'm so glad that we're talking about it. So, with this recurrence, I said, okay, well, first of all, I should say, the statistics are that 5% of all breast cancers can be related to a genetic cause. The other 95% is environmental. Okay. So, or something. Okay. So we're talking about environments in general. We're talking about external environments, and we're also talking about internal environments, because the thought is that there's this, kind of perfect storm activity that creates, the proliferation of cancer cells. Um, so in that, this with the recurrence, I said, okay, well, something's got to give. I got Something's got to give. Even though I am going down a westernized route, I am also implementing easternized medicine. I am also working with a nutritionist. Lily Padilla here in Los Angeles, who's also an ovarian cancer survivor, and she is helping me with changing the way I eat foods I eat, and what the things that I drink, my lifestyle. I'm also doing acupuncture, which I cannot say is. I can't say more about acupuncture. I believe that it is helping me. It's not. I'm not in any significant pain. I don't go to acupuncture for pain management. I go to acupuncture for immune support. Actually, she helps to build my immune system. She helps to kind of chill me out a little. She and I get into these. I believe that it's imperative for those people who are seeking or who are going through chemotherapy to really seek out acupuncture as an adjunct to what they're doing. And also, you do need to change your diet. The westernized feel, or I can't say westernized. The general consensus in medicine is that if you have a heart healthy diet, you're in a good place. Okay. However, there are lots of studies that are not in Europe and in other countries that are indicating the level of sugar in your body as being a feed source for cancer. And so one of the things that I am striving for, I'm not as successful as I'd like to be, but I'm working towards that. Is to really cut out the amount of a high level of sugar in my diet. And I am exercising. I've always exercised, but on the days that I can, I exercise, I do something. And so that's really, and the mind body connection. And so when you're talking about Eastern philosophy, meditation has been a huge part of helping me stay. I don't necessarily want to stay, because it ebbs and flows. My emotions ebb and flow, and that's something that happens with chemo as well. But it helps me kind of stay in a better place. It helps me understand my purpose. It helps me, which is why I'm here talking to you and Glenn and your guests about my story this time, because I, have been told that I'm supposed to do this because I've meditated, and it's time for me to share this experience with others.
How have you taken this chemotherapy, just like you did in your first episode of breast cancer and now your rediagnosis? How have you taken this and moved forward professionally? Any ideas from this experience that you've learned and things that you're considering changing in your professional career?
Absolutely. Thank you. I am currently in research and development for some programs that are going to be based for cancer patients. And at this point, I'm looking to develop a Pilates program that is based for cancer patients in general. But I think that, looking at breast cancer patients is probably the first place that I'll go with it. When I started doing some research on the topic and just breast cancer in general, it is such a huge topic. It's so vast. So it's almost as if I'm creating something out of this void, not void, but this huge amount of information. And so the research and development for me is from my own experience, and I'm also hoping that I'll be able to work with some other people who are currently going through chemotherapy or have recently gone through chemotherapy to implement some Pilates programs, some rehabilitation programs. There are rehabilitation protocols for physical therapy for breast cancer, because one of the things that occurs, there's a few things that occur with breast cancer. Post surgically, you will have potentially some arm and upper extremity stiffness and range of motion deficits and strength deficits. You might also get lymphedema. Your cardiorespiratory system will be impacted because you are in this kind of sedentary state. So there's many things, many avenues as a physical therapist I can look at and to create a program that would be successful for breast cancer patients specifically.
Excellent. I think we'll all benefit from that. We're speaking with Deidre Manns, a doctor of physical therapy and a certified Pilates rehabilitation specialist, and someone who is going through dealing with cancer. I wonder, just like we ask all of our guests, Deidre, for a specific health tip. That's something that you have come up with in your life, be it in your experiences now or in physical therapy, that you would like to share with our viewers.
Well, my biggest health tip and it's not mine, but I do, and I am not affiliated with this person. But this book is called Chemo Secrets to Thriving. It's a less than 100-page book. And it has been the best thing that has happened to me during my chemotherapy experience, because she is a breast cancer survivor. However, the author is a breast cancer survivor, and the author is Roxanne Brown. It's lots of pictures, really funny stories, but she gives lots and lots of tips about thriving through chemotherapy. So it's something that your family can read. It's something that you should read so that they understand what's going on with you, and that you also understand what's happening to you, and that you're not in it alone. The other thing that I would say is, more importantly than that, is to really seek out a support system. You have them around you. There's people around you that want to help you. And if you let them know, and you let them know that they need to be on your time, and that both parties, both you as the patient and the person who's going through chemo and the person who's helping you, the primary requirement is that you both check your egos at the door. You as the person who's the receiver needs to check your ego and say, okay, I need this help. I need my sister. I'm 44. My sister had to put my socks on. Okay. And my sister walked in the door and said, it's okay. I'm going to put your socks on. When my mom was here, she was, talking me off the ceiling at 2:00 in the morning because I was an anxiety attack because I didn't know what was happening to me. And so she was able to do that. And, if I asked her to do anything for me, she would have, and she did. So, so please, just seek out a support system.
Those are great tips. I would like to say that I just lost a good friend to breast cancer, and he was about 62 years old. So I wonder if you have a quick piece of advice for men and women in terms of checking yourself and follow-ups and examinations.
Thank you. Yeah, it is important that everyone breast cancer in men is less prevalent than it is in women. Every 1 in 8 women will get breast cancer each year, so that I think turns into about 12.5% of all women in the United States will get breast cancer or be diagnosed with breast cancer in a year. So that's a pretty big statistic. Men, it's less. However, it is imperative that you, as women, do your self exams, and you also make sure that you are doing them on a monthly basis. You teach your daughters how to do it, or you go to the gynecologist to make sure that they know how to teach you and your daughters and your sons how to check for lumps in their breasts and to get things checked out immediately. The standard of care is changing. The diagnostics are changing. Things are moving things are moving forward, and it's early detection is the cure. Actually,
Nice.
I wouldn't say cure. I would say it's the best prognosis. Early detection is the best. You've got better outcomes when you've got an early detection. It's when you don't have the early detection and things get a chance to manifest to a larger level that the outcomes are not as good.
Thank you for that. That's really good advice for everyone. I am planning on having some breast and cancer specialists on future shows, so look forward to that. This time, I'm very grateful to our special guest, Dr. Deidre Manns, for sharing her wisdom, her expertise, and her experience with us. While we were planning this show, we weren't even sure if we would be able to go ahead, but she was so courageous in dealing with the chemotherapy for the sake of our audience to give this information. There's a special thank you for doing that, and also to your sister who made sure that this show went on today, and to all of your support system.
Thank you.
I would like to thank all of my healers and all of my teachers for allowing me to be on my journey. And I look forward to being with all of you again, with Christina, as we search another quadrant of the healthcare galaxy. Until that time, I wish to thank you very much, Deidre, and I look forward to seeing everyone next week. But until then, I wish you all optimal health.
And again, thank you so much, Dr. Deidre Mann, and your wonderful, loving support team that you have. As we said earlier, before we started, what goes around comes around. So I do believe that you've built that support system around you a long time ago.
Thank you. Thank you. I mean, I've got, friends and boyfriends too that are, boyfriend. Should I?
Be careful.
Yeah. No, it's, my boyfriend cut my hair. So it's, it was a special time. So thank you so much.
Wonderful. We would like to thank each and every one of you for joining us in this new platform of education and information. We're grateful for your continuous support and look forward to hearing your feedback on how we can serve you better. We invite you to join us live every Tuesdays for Magical Medical Tour at 10:30 a.m. Pacific Time, 1:30 Eastern Time. Wednesdays for Trinity of Life at 11 a.m. Pacific Time, 2 p.m. Eastern Time, followed every other week with Flowing into Awareness with Anatara. And if you would like to contact Dr. Glenn Woolman, do so at myyogahub.com/G Woolman, or follow him on Twitter at Glenn Woolman. And of course, through his own website, glennwoolman.com, where you can learn about his metaphor square breath. Until we meet again, namaste.